Good morning, colleagues. Today we are going to discuss two innovative, minimally invasive treatments for uterine leiomyomas that are transforming our approach to fibroid management in the NHS. We will explore MyoSure histoscopic morcellation and Sonata radiofrequency ablation, examining their place in current NICE guidance and treatment pathways. These represent significant advances in the fertility preserving options of treatment and reducing the need for more invasive surgical interventions. By the end of this presentation, you should have a comprehensive understanding of when and how to use these treatments. We will examine their mechanisms, patient selection criteria, and how they fit into our current treatment algorithms. Most importantly, we will discuss effective patient counseling and shared decision-making approaches. Before examining specific treatments, let's establish the clinical context within the UK practice. Leiomyomas affect up to 80% of women by the age of 50 and remain a leading cause of hysterectomy. However, NICE guidance now emphasizes a stepped approach, prioritizing fertility-preserving treatments where appropriate. The evolution represents both improved patient outcomes and the better resource utilization within the NHS. The MyoSure system represents significant advancement in the hysteroscopic surgery. Unlike traditional resectoscopy techniques that create tissue chips, potentially obstructing visualization, MyoSure simultaneously cuts and aspirates the tissue. The dual channel port designs maintains the excellent visualization whilst integrated suction prevents tissue fragments floating around in the uterine cavity, leading to faster and safer procedures. This doesn't involve any electrosurgery. Patient selection. The patient selection is crucial for MyoSure to succeed. We primarily target submucosal fibroids, type 0 to 1 and the 2 according to FIGO classification. Type 0 fibroids are ideal, being entirely intracavitary. Type 1 fibroids, which are less than 50% intramural extension, do very well, and type 2 requires careful evaluation of the intramural portion of the fibroid and additional treatments may be needed. Size is the key. The fibroids larger than 5 cm cannot be done usually with this procedure, at least in a single session. Sonata instead presents a paradigm shift in the fibroid treatment. Unlike histoscopic approaches limited to submucosal fibroids, Sonata can treat fibroids in any uterine location, provides real-time visualization throughout, allowing precise electrode placement and ablation zone monitoring. This transcervical approach means no abdominal incisions, suitable for outpatient treatments under conscious sedation or general anesthesia. Sonata approval by the NICE in 2021 under IPG 694 was significant for UK practice. Unlike MyoSure limited to submucosal fibroids, Sonata treats all fibroid types regardless of their location. Broad patient selection criteria makes suitable for many women who would otherwise require more invasive treatments. The day case nature fits NHS efficacy targets, with early UK data showing excellent 80 to 90% symptom improvement by 12 months. Now this one shows a comparative efficacy data between MyoSure, Sonata treatment and transcervical resection of fibroids. As you could see, MyoSure is much quicker. Sonata takes 30 to 90 minutes and same as TCRF. Complete resection rates 90 to 98% with MyoSure, 85 to 92% with resection, and ablation is Sonata, so no removal is necessary. Symptomatic improvement is excellent, 80 to 95% in all treatments. Reintervention rates is low, and the return to normal activity is much better with Sonata. So these are the real advances. Let's compare the efficacy of Sonata with MyoSure. Now this is comparing, apples with bananas or something, whatever you call it. So they are both very different. However, both give treatment excellent outcomes. MyoSure offers complete tissue removal and immediate histological diagnosis with shorter procedure times. Sonata's strength is its versatility in treating fibroids in any location with preserved uterine anatomy. Both show 85 to 95% symptom improvement with lower reintervention rate. Choice often depends on fibroid characteristics and the patient factors rather than efficacy and differences. Safety profiles. Both are extremely safe. The complications, like common complication 1 to 5% with MyoSure, these include uterine perforation, uterine cervical lacerations, fluid overload, postoperative bleeding, and rare infections include infection, intrauterine adhesions, gas embolism, etc. With Sonata, complications are rare. Common include post-procedure cramping, pain, vaginal discharge, which can last up to 2 to 6 weeks, nausea and vomiting can happen, unit tract infection-like symptoms are also possible. Rare complications could be thermal injury or device failure or inflammation of the endometrium. Both procedures have excellent safety profile but different risk patterns. MyoSure complications similar to traditional hysteroscopy with perforation and fluid overload main concerns. Sonata complications are generally mild with postoperative cramping and discharge as mentioned. Now, fertility and pregnancy outcomes. This is really important. MyoSure and fertility improved. Conception rates after submucosal fibroids are well documented. Reduced miscarriage rate is also recorded, and there's no impact on the uterine integrity. Pregnancy can be attempted after 2 to 3 cycles of MyoSure treatment, and normal vaginal delivery is possible because there is no uterine incision or weakness. Sonata, on the other hand, there's limited fertility outcome data because of the new treatment, and theoretically it preserves fertility. It's recommended that women should wait 12 months prior to embarking on a pregnancy after the treatment. Unknown effects on the pregnancy complications so far, and consider alternatives if the woman wants to get pregnant quickly after this treatment. Submucosal removal of the fibroids, according to the Royal College, is recommended because the evidence is very strong that type 0 fibroids are improved fertility outcome after they have been removed. Type 1 to 2 also there is good evidence. However, the evidence for intramural fibroid is not very clear, and Sonata or myomectomy should be considered if needed in these cases. Combination approaches can also be used. So this slide follows NICE guidance and current UK practice. Medical management remains the first line of most patients for submucosal fibroids. MyoSure has been the preferred hysteroscopic approach due to technical advantages. Sonata fits particularly well as a second-line option for the various types of fibroids, offering outpatient treatment with excellent outcomes. Key is matching right treatment to the right patient and the symptoms, fertility desires, and fibroid characteristics. Finally, the treatments are myomectomy and hysterectomy. Now, we also need to consider health economics and NHS considerations, cost effectiveness, reduced theatre time, day case procedures, low morbidity, faster recovery, fertility preservation. These are all beneficial. Reduced intervention rates and the patient satisfaction. Implementation in the NHS, initial equipment investment is needed. Training and proctoring is also needed, suitable for tertiary or DGH centers, and sports choose and book and 18 weeks. NICE economic analysis supports both as cost effective, as you can see from this table, the various treatments and their cost effectiveness, their cost, length of stay, and the recovery times. It shows that Sonata is more expensive than MyoSure, but less expensive than the other invasive treatments for fibroids. So patient counseling and informed consent is very important. Key counseling points include realistic outcomes and expectations to be explained, alternative treatments discussed, procedure-specific risks and benefits explained, impact on future fertility should be informed. Effective counseling is crucial for these new treatments. Patient needs clear, honest information about expected outcomes, risks, and alternatives. Important to acknowledge that while short-term data is excellent, we have limited long-term follow-up compared to traditional treatments. Shared decision-making should guide treatment choices, considering not just medical factors but patients' values and preferences as well. So, what does the future look of these treatments? The future looks promising for minimally invasive fibroid treatments. Key research priorities include long-term outcome data, particularly pregnancy outcomes after Sonata. We are seeing technological advances in imaging guidance and energy delivery. From UK perspective, establishing national registries and standardized training programs will be crucial for maintaining quality and gathering robust data. So what are the key take-home messages? Treatment selection. MyoSure is ideal for submucosal fibroids, whereas Sonata is suitable for all types of fibroids and locations. Both are nice endorsed treatments, have got excellent safety profile, and clinical benefits include day case procedures offering NHS value, excellent fertility preservation option, over 90% improvement rates, and low intervention rate.